Brothers podcast of 5 Pillars of Mad Monolith production.
Assalamu alaikum wa rahmatullahi wa barakatuh, dear brothers, sisters and friends. I pray you all well and welcome to another episode of the Blood Brothers podcast with your host, Dilly Hussain. This is another episode in light of the COVID-19 pandemic. For the sake of clarity and time sensitivity, the date today is Sunday, the 29th of March. Today's guest is someone who is a GP, but more than that, he's a dear brother, teacher and mentor of mine, someone who is very beloved to me. He's, besides being a GP, he's also the chairman of Islamic political party, Hizb ut-Tahrir, and that is none other than Dr Abdul Wahid. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh, Dilly, and brothers and sisters watching. How are you?
I'm very well. How are you?
Alhamdulillah. Can't complain, bro.
Alhamdulillah. There's a bit of interference, so please forgive me for that echo. Can you hear it?
Yes, I can hear you well. Yeah.
Okay, fantastic. You know, sometimes I have to be very mindful when I introduce you on things because there's a blurry line between brother and uncle, but you have the heart of the brother and the body of even a younger brother.
So shall I call you beta?
No, you can't do that. How's things for you?
Alhamdulillah, beta. I'm fine and I'm okay. Yeah, no, alhamdulillah, everything's good. Very busy, but very good, mashallah, alhamdulillah. Yeah, I would say this lockdown hasn't made anything quieter for me. I'm certainly not looking for things to do.
Okay, so it's interesting that when I was speaking to you about frontline GP, you said, well, what's a backline GP, right?
Yeah.
Now, in terms of like the volume of patients that you're dealing with at your clinic, has it been the same or has there been a clear spike?
There was a clear spike the week before last. It was massively busy 2 weeks ago. And then actually in the last week, a lot of GP practices have changed to dealing with things by phone in order to stop patients coming and cross-infecting themselves in the healthcare setting. And then you only get people seen where they absolutely need to be seen to reduce that infection risk to each other. So that kind of changed it a lot last week. I don't say it wasn't busy, but it was very different. It was not very little face-to-face contact. But as I'm looking forward, I think that some of this will change as when the so-called surge happens, there will probably be a spillover from what the hospitals will be unable to cope with into the community. So then the kind of GP type work will be added to by stuff that ordinarily would be dealt with by hospitals. It's a kind of calm before a storm we're expecting, actually. That's how I would put it at the moment. Although I'd say it's still been busier than normal. Yeah.
And for the patients that you have been seeing face to face, are there any kind of extra protective or precautionary measures that you take in terms of when you speak with them and when you talk to them,
so
opposed to a normal
we wear masks, aprons, and gloves. These are the three things we wear, and there's a lot been said about this, that actually there should be goggles. Actually, there should be not just aprons, but things that cover the sleeves as well. There's a lot. I mean, there was an article yesterday that mentioned that the decision on this was taken some while ago, and it was a cost-saving thing. It reflects a lot, actually. If there had been proper investment at certain times, proper decisions at certain times, the overall cost to Britain, in terms of the economic cost, and life cost, would be a lot less. But it's spending too little, and now probably what's going to come is going to be, even if it's right, might be a little later than is ideal, and that will have a cost, undoubtedly, on lives and on the economy, because we're in unprecedented times, actually.
Now, there's been a number of people have criticised the UK's handling of the pandemic, especially when they first proposed the possibility of herd immunity. Then they kind of scrapped that. Now they've implemented a partial lockdown. Major cracks within the NHS are now clearly showing under-resourced, etc. I'm going to posit to you, Abdul Wahid, based on a conversation that me and you had yesterday via Telegram. Yeah, how does any state, any government, Islamic or not, adequately prepare for a pandemic? How can they?
It's a good question, and I think the answer I said to you there is that no state can ever plan for the unexpected. So earthquakes, disasters, disease, floods, these can happen. But then some things are not wholly unexpected. So if I give you an analogy in Britain, how many years have we now seen flooding that has flooded people out of their homes time and time again? The first time it's happened, a government could realistically say, you know what, this was unexpected. But when it happens 3, 4, 5 years in a row, they can't then say this was unexpected. They have to have had some contingency plans. And even in year one, some experts could have said, well, you've run down the flood defences so much year after year, decade after decade, underinvesting. In the end, at some point, it would have been inevitable. And you can say the same with healthcare, really. The system here is run on a very low budget compared to comparable countries, developed countries, which use different health systems. They might be private, they might be insurance, they might be state. But in the rank, Britain ranks very low in terms of how much it spends. And also its cushions for the most vulnerable in society are very thin indeed. And so when something hits like this, it means there's no cushion for people. And it's not true to say it's wholly unexpected. Department of Health, public health, governments do know that the potential for a viral pandemic like this has been there. When SARS first appeared in the Far East years ago, there was talk, will it be contained to the Far East, or will this thing become a global pandemic? And it didn't. Then some years after that, there was swine flu, and it did become globally widespread, except it just wasn't a very serious illness. So a lot of the scenarios exist, and the experts know that. And that's why where some of the experts are criticizing government, they were saying that, in January, they could have been on red alert. They should have been on red alert. It was clear this is either going to be locked down in one province in China, or it's going to affect the whole world. And then if it affects the whole world, we don't understand this virus yet. We don't know its full potential. So they could have been more ready than they have been. And I think the criticisms are really legitimate. And the other criticism is when they did put their plan on the table, it was frankly the wrong plan. It was a plan, and this is probably good for brothers and sisters watching to understand. They would have had several scenarios put down for them by the experts. So when the politicians say we're led by the science, that's only partially true. They are, but then they have to make a decision, right? And they would have calculated option A will affect the economy slightly, will cost X number of deaths and X amount of inconvenience. And option B has variables, and option C maybe the least deaths, the most inconvenience, and the most economically costly, right? So if government goes for the cheap option, which protects the economy but costs most lives, they may have an argument for that. And in fact, the herd immunity argument isn't stupid. If I just explain, I mean, this thing people would have understood if you protect, if 60-70% of the population becomes immune because they've got the infection, the remaining 30-40% are less likely to get the infection, right? But I think if there is a strength to this, the strength is that they're not expecting the surge now to be the only surge. They're expecting in winter this virus could come back with a vengeance. So if you lock everyone down, what you're doing is you're potentially making the winter surge much worse. So if there was a degree of immunity in the population, they'll be more protected when it comes to the winter. So it's not a completely crazy idea. It's just actually what they found last week was when they did the maths, the number of deaths they were estimating before was many more. They're saying potentially up to 500,000 could die with the existing policy. So that's why there was There's a very interesting article in the Times which explained how in literally 48 hours they not just changed the policy, but they put in place the current steps that we have now, which even then are not arguable. I mean, I don't know about where you are, Dilly, but where I am, it's a very light touch lockdown. It's not really, it's
Same. I'd even barely call it a partial lockdown, if anything. I mean, the police officers are politely approaching people and saying, "Hey guys, you need to be home," but there's still people out and about,
Yes.
not necessarily respecting social distance. Yes, things are quieter, but it's not a full lockdown by any means. It's an interesting point you made about the options put on the table to governments. And with regards to the UK, and I'm assuming the same would be the case with the US and other Western nations, is that they would have to make an assessment based on death toll against their economy, right? Is that reflective of normal capitalist states, or is that something which is understandable that any government or any state, again, Islamic or none, and when we say Islamic, let's just make it clear that none exist comprehensively as we speak, that they would have to do some kind of checks and balances that, look, if we tell people to lock down, if we have an isolation policy across the country, that there are key institutions and industries within this country that if we stop, it can bring the economy of that respective state to its knees, which will then cause even greater problems besides a pandemic. So is this something which is just specifically restricted to capitalist countries, which is practically the whole world? Or is it something which is understandable and the economy is something that has to be factored in when looking at pandemic policies?
So you're right. Both play a part for any political ruler. I just that you have to understand in capitalist states, it will always be the economy that trumps everything else. And there are going to be some who are incredibly greedy and in the pocket of the capitalists themselves. There are others who philosophically believe that if the economy is damaged, that costs people's lives in other ways. Okay, so but truthfully, what you've seen here and in the States as well, I think especially here in Britain and in the States as well, is the decision making has very clearly showed in the early stages that they put the economy first. All right, and the lack of a cushion. I'm wondering why the death rate in the States, the most wealthy country on the planet in human history, is so high. And I wonder when they do the analyses of these things, it will be that the people dying are the underclass in America. The people dying are people who, because the health insurance system doesn't cushion them at all. Okay. So, it may be that when somebody pays their health insurance, that their premium doesn't include the critical care. If you see what I mean, it could be that it's like that. I don't know. I haven't looked at it in detail, but I think you have to understand that in these states they do make these decisions, and even ultimately, when the government's changed its mind, it's changed its mind because if they had let it play out, it would have been a catastrophe for them of unprecedented proportions. I mean, you can't have people being managed in huts outside a hospital. Yeah, you can't have images of like masses of bodies waiting to be buried without, the potential for rebellion. I mean, frankly, that is the kind of scenario in months to come they have to think about, a potential scenario they have to think about. So yeah, the difference I think is in the concept of Islam, the principles of Islam in governance. It cannot come first. The economy cannot come first in this situation.
Preservation of deen and preservation of life.
Absolutely. So when Rasulullah sallallahu alaihi wasallam said in a famous hadith narrated in Sahih Muslim, "Kullukum ra'in wa kullukum mas'ulun an ra'iyati." Every one of you is a shepherd, and every one of you has a God responsible for what they are responsible over. فَالْإِمَامَ الَّذِي عَلَى النَّاسِ رَائٍ وَهُوَ مَسْئُولٌ عَنْ رَعِيَّتِهِ. And the imam of the people, the leader over the people, the Khalifa in the case of the Muslims, he is a shepherd, he's a guardian, and he's going to be asked about what he was responsible over. And in these matters, politics in Islam, that if there's a principle, one principle, one principle of many, but one principle is looking after the affairs of people is the role of the politician and the ruler. So you can't look after the affairs of just the rich people who run the businesses, that own the businesses, that are saying, look, if you let us go down, all these people are going to lose their jobs. You can't just run it according to that. You have to run it according to what is best for the people. And that's firmly embedded in our understanding. And when Sayyidina Abu Bakr as-Siddiq radiallahu anh took his bay'ah as the first Khalifa, he said in a famous narration, in the meaning, the weakest amongst you are foremost in my eyes until I have restored to them what is their rights. So you have to actually look from the base people who are going to be affected by this most. And I mean, even the decision making here recently in London, mashallah, we've seen all the homeless people are going to get put in hotels. Yeah. But in the midst of winter, when they were on the streets and they didn't have the potential for infecting people and therefore affecting the economy of London, there was no hotels for them. Yeah. It gives you some insight into the workings of that political thinking and that philosophy that underlies the whole thing.
Just quickly before we move on to the topic of isolation and the kind of precautions you're taking with looking after your dear mother, in terms of now providing these services, is it coming across as too little, too late? Perhaps. What do you think?
It does feel like that as a doctor. It does feel like that, and we're without any axe to grind. Back at the beginning of February, I actually had a continuous cough, which by today's standards, I should have been self-isolating for 7 to 14 days, right? And I looked on all the NHS guidance and I looked at our local policies, and the only people that would get tested at that time were people who traveled to China, Wuhan province in China, or a few other countries where it was established, or had contact with a proven case, okay? So and I was seeing patients like that as well, and I was checking the guidance, and there was no way to get these people tested and isolated, all right? Only if somebody was so sick, they were ending up going to the hospital where they're getting tested then, or if they'd been traveling, or if they'd had direct contact with a proven case. So now when we're 6 weeks down the line from that, I'm thinking to myself, the South Korean policy of testing, quarantining, contact tracing, and actually then letting a lot of society getting on with things themselves may have seemed more expensive in the beginning if they'd done it, but actually it's actually locked down the virus pretty well in South Korea at the moment. But people were coming back from China and other places, and cruise ships. Britain was letting them back when, the Islamic philosophy of if you've got a plague in a region, nobody goes in, nobody goes out. You don't encourage your own citizens to come back from a plague region. It doesn't make any sense. So it's very hard not to think that what we're doing now is too late, and it's still a bit too little, actually, compared to other places. Germany seems to be doing better than Britain. And the other thing, you mentioned some stats, Dilly. I think you said it's about 17,000 is the current cases in Britain.
Yeah, yes? In the UK, yes. Yeah.
So
17,000 with 1,019 deaths.
So brothers and sisters should know that number means 17,000 proven COVID positive patients, right?
Yeah.
Now, in the last week, 8 days, I've been on the phone to 5-6 people who are really unwell, fevers going up to 40 degrees centigrade, coughing such that I can hardly talk to them on the phone, but they haven't met the criteria to be seen in hospital, right? So those 5-6 people don't have any COVID positive testing. They're suspected cases. So for every one of these 17,000 that's had the testing done, my guess is you can probably say there are 4 or 5 who have had severe disease, right? Part of that 20% who they
Yeah.
say there's 80% have it mildly, 20% have it severe, and 5% so severe they end up in hospital. So this 17,000 is largely the 5% that's been in hospital. Okay.
Okay.
There are a lot of other people out there who are very sick in the last week or two with this virus who haven't made it to hospital and haven't had tested. And then there's even more who don't even know they've had it or not even
So
sure.
you're saying the number is actually significantly higher in reality?
Oh, unquestionably, the number is higher, which actually means calculating things like death rates and percentages. All of this is a bit, there are some people I know that give day by day number counts. And, I just look at these things and I think, you're sharing this data, but it's actually not that helpful. If you tell me today the death rate from COVID in Britain is, for argument's sake, if you say it's 5%, right? Yeah. Actually, it's probably less than that because that known caseload of 17,000 is actually probably in reality minimum 5 times that amount. Yeah. So that then the percentage that died. So you can't really make a lot of these figures. They're interesting and they're useful. I suppose the one thing they're useful for is plotting where we are on that exponential curve. Yeah, that's the useful thing. Excuse me, I can't share my coffee with you.
No, I would love to have shared a coffee with you, but unfortunately, we're respecting social distancing, can't we?
Absolutely.
I'm going to ask you a bit of I don't mean the question to come across brutal or cold-hearted, right? But in terms of governments, especially the NHS, I had Dr. Simon Iqbal previously from Manchester, and she said, look, if it comes to a decision between saving the life of someone who's younger than someone who's elderly, it's very likely that hospitals and medics will opt for the person who's younger. And there does seem to be a trend, at least amongst Western governments, the US and the UK specifically, amongst others, France, Germany and others, where they've made it quite clear that, look, if push comes to shove, it's going to have to be the elderly that are going to have to take one for the team. And so that mindset of the elderly are already on their way out, so we have to prioritize those who are younger. Is there some kind of maslaha premise on this?
So it's a really good question, and so the answer to this is yes, this thinking exists, and no, it doesn't. Okay, and I'll explain what I mean. So just generally, there's a strand of thought in Britain that will think like this anyway. Older people are generally forgotten about quite often, and there's an individualism and a selfishness, and some people will think about survival of the fittest and this sort of philosophy, and sadly that is a strand of thought. When I was at school, they used to teach us about the Reverend Malthus, who used to say that the population of the world was too high, and therefore disease and disaster and wars, these are levelers of the population. I don't think Malthus was saying they were a good thing, but some people the way our teacher used to tell us that, it was like, hey, that's life. And it was almost like a survival of the fittest. That strand does exist. And in fact, one of the papers this week reported that a former senior government health advisor said that elderly should voluntarily decline going to hospital. Yeah. So unfortunately, that strand exists. Now, because that strand exists, people are not going to have so much trust in when doctors and nurses are making decisions, which is a problem. Because I will say, when I started as a doctor 29 years ago, mashallah, when I started as a doctor 29 years ago, people did make decisions based on age. But now, definitely the last few years, the thinking is not so much on age. The thinking is much more on, will somebody benefit? Will somebody, as an individual, not the society, as an individual, will this person benefit from me giving them treatment? Will it do them harm? Okay. Therefore, should I offer that treatment? So, let me give you an example. Old people get arthritis, right? Imagine you've got an elderly person who's got severe arthritis in their knees. And maybe they've now hit 90 and they're finding it really hard to walk. And they've got other health problems. it's not because they're aged 90 that the surgeon may not offer them the operation. It's because the benefit from the operation might be very small and the risk to the person might be very high. And if I did that same calculation on a young person, it's not because of their age, it's because of their risk and benefit for that individual.
Yeah.
Okay. And it's actually the same with ventilators. It is actually the same with that. So, there is a person who is a smoker, a person who has chronic lung disease, a person who's obese. They might need the ventilator more, but they actually might not benefit from it. It might actually cause them other problems. They might get infections from having ventilation. And so doctors will be making decisions when the system gets overrun. And I don't believe they're making those decisions now because they're working at maximum capacity in the intensive cares. It hasn't yet got to the stage like Italy, where they're literally making life-death decisions like that. And when they do, they will, it could be that a fit 80-year-old is a better candidate for a ventilator than an unfit 60-year-old that has multiple lung problems and is a smoker and whatever. And they might go for the fit 80-year-old. They might genuinely do that. But en masse, it will look like they're choosing the younger people than the older people. And if you've got this background bias in society, which is slightly biased against older people, it will make you feel that you don't trust what's going on. Whereas in reality, doctors and nurses do not, it's not simply age they make that calculation on. It is really isn't. It is, but older people do have more complex problems which make these things risky. Yeah. And I think the actual health approach is not a bad approach. If you applied that health approach in Bangladesh, Dilly, where people have some respect and reverence for their older people, you would still get more younger people getting the treatment than the older people. But you would trust that the decision making was more done on a more fair basis. Whereas here, people they see this general attitude in society. And they worry: is my older relative going to be chucked on the scrap heap? And that's a dilemma I think we have here.
Now, if I'm correct, you are the primary carer for your elderly mother.
MashaAllah. Yeah, I don't know. I mean, alhamdulillah. I live with my mum, but alhamdulillah.
Okay.
I mean, yes.
And how is her health? How is she?
Alhamdulillah. She's more worried about giving me germs than I am about giving her germs. It seems to me. Me giving her germs at the moment. Yeah. So
may Allah bless her and give her a long and prosperous life in Jannah in the hereafter.
Make dua for her, inshallah.
Of course. What kind of precautionary measures are you taking in terms of, just trying your best in not giving her germs or you coming back from the practice? I know you have a very interesting theory about isolation. And that it should be understood by case because it can have other detrimental ramifications of the elderly. Tell me a bit about those two things. So what are you doing personally to keep safe distance or trying to avoid any kind of the spreading of germs? And secondly, just a bit about your understanding of isolation, especially amongst our elderly.
So I think generally, I know people have said it over and over and over again, but this issue of washing hands properly is really important. So when I come in from outside, I think the first thing I try and do is a proper long hand wash. And that's despite the fact that when I left work, I've done a proper long hand wash just before that. And if like a parcel delivery comes from outside, I'll do a proper long hand wash before I, do other things before it. So I think that is really important because for me that it's not me I'm worried about. It's carrying the germs to my mum and to other people that I need to be conscious of. And I think everyone should be doing that. If anyone in the family had the symptoms, cough or fever, that person should be literally quarantined off in such a way that doesn't carry the germs to the most vulnerable. No question about that. You need to think, if you get symptoms yourself, the first thing you need to think about is, I do not want to carry this to other people. Yeah. And really then very strict isolation measures to deal with that. The issue of like, should the elderly just lock down for 3 months? I think is, how can I say that? There needs to be some nuance on this, right? And I understand where people come from. The general principle should be, don't carry germs to the vulnerable and the elderly. So yes, it is better for them if they're not going out, not mixing with people who are carrying the virus silently. The germs are not carried to them. Just like it's the same for all of us, actually. That's the current policy for everybody. Forget just the elderly. But I see and I hear, and people are asking me about questions about how they should approach their older relative. And this was maybe even more so before the lockdown happened. With my mum, she would not go out very much in the week anyway, right? There would be a couple of trips to the shops for half an hour with somebody, and maybe she'd come with me to the masjid on Friday, okay? That isn't much for her to go out. But when she would go out, she'd feel a lot better in herself. She would have got some fresh air. She would have felt some purpose in doing some shopping and bringing some things home for people. She would have done some walking, which she herself would say, if I don't walk, my muscles get weak. When old people's muscles get weak, they fall more, right? So we have to bear in mind that actually the physical and mental cost for the isolating elderly people completely is very high. And I have an aunt who is locking herself in her house. Generally, she doesn't want even her kids to come and bring the virus. Alhamdulillah, I respect that in her, all right? But I have other relatives who actually, if their family members weren't coming to them, weren't giving them a kiss, weren't giving them a hug, weren't taking them for outings, they will feel that life has changed in a very, very bad way, right? And so we need to, you and I need to judge these things case by case. The general rule, isolate, prevent the virus coming, keep the virus away from these people. The specifics of how much you do, how much you don't do, go out, don't go out, within what's allowed generally, I think you have to understand your older people. And I'd give the analogy, every year coming up to Ramadan, I get an elderly uncle or auntie with their son or daughter coming with them to the surgery. And the son or daughter is saying, tell my mum or dad they're not allowed to fast. All right? And mum and dad desperately want to do some fasts, if not the whole month, right? And I have to look at their medical history, and I have to look at their general well-being. And I can't just say to the son or daughter, I know you love your mum or dad, but your dad's come with tears in his eyes saying he wants to fast. What do you expect me to say to him? I can say to him, take these precautions, drink loads, eat well properly, suhoor, have a rest during the day, try it. But if you can't do it, you shouldn't make yourself sick. Maybe you can't do every single day. It's very hard doing fasting back to back, day after day. I can give all those things, but why are you saying like something which is bringing tears to their eyes? When I get old, when you get old, Dilly, you may want to your life may well revolve around 5 trips to the mosque a day, or 1 trip to the mosque a day, or 3 trips to the mosque a day. That might be the whole of your basis of your routine. When your son or daughter comes to you and tells you, no, you can't do it for your own well-being, well, it might be for the well-being of your body, but recognize that it might cost your mother or father or grandmother or grandfather's heart and well-being emotionally, And we have to make these balances. So I stress again, the general rule, do follow the advice, isolate and try and prevent the virus going. The specific rule for your loved one, you have to know them and you have to try and do, and maybe even negotiate with them. So if they say, no, I want to go to supermarket, then say, it's so difficult it's so crowded, it's so filthy. My mum, even before this all happened, when she goes to supermarket, she holds onto the trolley for balance and she puts a tissue on the handle, She doesn't like it anyway. So I might say to her, okay, let's go to the high street because that's a bit more open. Yeah, it's less less in everyone's faces and stuff. So I think that's the way I would approach it. Yeah.
Okay. Now looking towards how Muslim communities have responded to the pandemic and the weeks building up to the kind of red alert panic mode. Yeah.
Yes.
And looking at the UK specifically, we've had, and broadly this applies to diaspora communities in the West. We've had stampedes over rice, atta and oil. We've had the hoarding of food. We've had Muslim shops increasing prices, but that's not necessarily restricted to just Muslim-owned businesses. Other businesses have been doing it as well. Masajid reluctant to close until the very last minute, until the government announced that places of worship would have to be locked down as well. Even when there was guidance, they were refusing to close down. Hundreds. I would even go as far as to say more than half of masajid were still choosing to remain open. We've had rulings pertaining to not praying Jum'ah, potentially praying virtually with the radio playing. We've had fatwa pertaining to the burial rites, not giving ghusl and the kafan, the tayammum of the kafan. We've had so many of these things happening in the last 2 to 3 weeks. Both of us, we have mutual friends and contacts who have also been very much involved in some of the things that we've been seeing and all these things that I just mentioned to you, right? What do you think it's reflective of? Do you think it's reflective of a robust community that's trying to prepare itself for the pandemic? Do you think it's reflective of what you said to me in a conversation that we had not too long ago, a pandemic of anxiety? What do you think? Is this the Ummah dealing with a new reality?
So I think there's lots of things you've mixed up there. I think the first thing I'd say is Muslims living in Britain are affected by many of the same things that other people are living in Britain by. So there's a general climate of anxiety. There is a common emotion of anxiety in the society, and it's in part real. The virus is significant. In part, it's fueled by 24/7 media coverage. In part, it will be fueled by the fact that generally people in society don't think about death very much in a comfortable, affluent society.
Absolutely.
I would be surprised if in societies or environments where they have to deal with death and suffering and hardship day in, day out, that they're overwhelmed with anxiety because of the virus. Allah forbid, if the virus hits the people of Syria or the people of Yemen, it will affect them far worse. But I would guess their resilience will be far more because they have dealt with so much hardship, death and suffering, and that has brought them closer to Allah. And that has reminded them of the temporary nature of this life. And we who live in a comfortable environment where, in some communities you might have, in the heart of the Muslim community, you'll have janazas fairly often, but in some communities you might have janazas once or twice a week even, yeah? And in amongst non-Muslims, it's like death that is not talked about and suffering is not common in this kind of way. So we're part of that society. And the anxiety, I said this to you, like there are two epidemics at the moment. One is COVID-19 and one is anxiety. And that's true. A lot of what I've dealt with in the last 2 weeks is anxiety. I've got a cough, I've got a cold. The NHS 111 advice, the advice on the TV, it's very clear. It's constantly talking about 80% of people get mild illness. They don't need to do anything. They just need to not spread it to other people. But people are anxious and people ring and people call. And the anxiety drives a survival instinct. So, fight or flight. And so, that will be natural anywhere. So they'll hoard toilet paper, they'll hoard rice, they'll hoard flour, they'll hoard oil, they'll hoard medication. Okay, a lot of the busyness, doctors will tell you in the last couple of weeks, is patients who are worried they won't get their medication. So they're ordering it in advance. And that's leaving the pharmacist short, which means that, when somebody comes in a week's time and says, can I have my medication? The pharmacy is going to say, I've run out of stock.
No,
yeah?
You've run out, yeah.
So, now that survival instinct is made worse in a society which encourages individually, encourages materialism, encourages that thinking. So if we have, as a Muslim community, become guilty of that, it's because we are part of a society where such things are common. And if we are Muslims, part of the benefit of this Islam should be that it reminds us of our attitude to things like rizq. The rizq comes from Allah. The shops could be completely empty, but Allah will find a way to provide for you. Yes, if you trust in Him and you tawakkul, reliance on Allah, and also rulings that actually we've learned, an Islamic ruling coming out that it's prohibited to buy something so that you monopolize it and other people are left without. So that these things are good for us to learn. They are indeed new realities for us, but with regards to Jummah and Janazah and stuff, Dilly, I think this is actually a reflection of a lack of leadership, a lack of genuine Islamic leadership, and a lack of leadership in the country. All right. So these are two different things. One is the different responses to Jummah reflect a difference in opinion on an Islamic ruling. So all the fuqaha will say, all imams, all scholars, all tullab al-ilm would say Jummah is wajib on the adult male who's physically capable, right? And all of them will say it's wajib not to cause harm to others or to be harmed. Now, reconciling when does the going to Jummah or holding the Jummah gathering cause harm or cause you to be harmed or cause harm to others, this is going to be a subject of discussion, right? And it's not an easy one to work out. So if I give you the analogy in China, when the pandemic is starting in Wuhan city, should the mosques in Beijing lock down?
No, because it hasn't spread there yet.
So
I don't know.
So we don't know.
That's my
you see
view.
what
That's
I mean?
my
There
view,
could be a legitimate debate that one could say, oh, just in case we've got silent cases in Beijing, we should lock down. And others would say, no, Wuhan city should lock down. And within Wuhan city, maybe they can go for Jummah all they like, right? But it shouldn't spread. No, this is a legitimate thinking. It's possibly.
No,
it's like, do you see what I mean?
If it's contained and quarantined in Wuhan, then people can pray Jummah in Wuhan.
What it reflects is a sincere difference of understanding of what is the actual harm or what is the risk of actual harm, and what degree of harm is required to restrict a wajib, right? And you will have difference. Now, in the Islamic understanding, we are ummah of Muhammad sallallahu alaihi wasallam of 1.2, 1.5 billion people, right? Where you have such a difference in any area or any region, there should be an amir that settles difference of opinion, right? You are inevitably going to have difference, and and there is no, in the Muslim world today, one reason you get different responses at different times in different countries, different cities, is there is no such amir to solve that difference. And where there are rulers, they're not terribly well respected. So I might be looking at what's happening, say, in Pakistan, where the government is saying, you should stay at home, you should lock down, there's curfew, and some large Islamic sects are holding gatherings of thousands, okay? And what that reflects is not a suicidal mentality. It doesn't reflect a majnoon mentality. It reflects the fact that they don't trust this guy sitting there to make a sincere decision on their behalf, right? And so that's the leadership in the Muslim world. Let's come back to Britain. What is a masjid supposed to think when 2 to 3 weeks ago the government advice is very light touch, right? At that time, football matches are going on, the economy is running fully, none of the festivals have been cancelled like Glastonbury, people are talking about the Olympics and Euro 2020, and then suddenly there's a debate amongst the Muslim community. Oh my God, we need to lock down our masajid and we need to cancel Jummah and Jamaat prayers. Don't you know you're harming everyone? even though those brothers and sisters who are arguing that, even if they're right in terms of their understanding of the health risk, the average imam or mosque committee chair will be looking at the stark contrast in what they've been asked to do compared to the rest of the country and thinking, why are they asking me to close this down? And
if I may interject,
sorry, just to finish that point, in addition to that, no, go on, you go. I talk too much. Go on, you go.
No. I love hearing your voice, but the point is, it's a point relating to the one that you've just made. The counter argument would then be, Abdul Wahid, is that why do we need the government to lead in guidance and telling us what to do? Why can we not take the preemptive measure? And why do we have to wait for the government?
So this is, I'm sorry to say, this is a sort of level of decline in thinking of us as Muslims, which unfortunately, it's like, this is a health matter, right? But this is a public health matter. This is a health matter which requires a political decision to solve it. If the, 3 to 5 million Muslims in the UK decide to lock down themselves and everything else is carrying on, it's not going to make a dot of difference in that context, okay? It's
because everything else is still running.
You require a decision. This is the lack of leadership in Britain that did not lock it down and send a clear signal to all the public, including the Muslim community here, that this is what is required, all right? So when people were having this debate, I couldn't get my head around it. It would be like saying, it would be like saying that, in fact, when you look at the Church of England, for example, or the Catholic Church, who are actually much more used to a sort of secular split, they had no intention of stopping their normal services. They had no intention until they were told that this is a sufficiently big public health issue to do that. And that's not because they don't care about the issue. It's just because they recognize that there are some issues that need to be dealt with from a top-down approach. You can't make decisions on this sort of issue at a local level or an institutional level like this. If you do, alhamdulillah, you might be doing something. If you had that understanding yourself as a chairman of a mosque, and you said, okay, you know what? I'm going to put the hygiene measures in. I'm going to put the mats in. I'm going to discourage elderly people from coming. I'm going to ban anyone who's got symptoms, right? And you do all of those things yourself for the sake of your congregation, alhamdulillah. But that person that then self-isolates from Jummah, if you like, goes to the supermarket and is within 2 meters of somebody else. They're using the same shopping trolleys. They're then going on the underground, commuting to and from work or on the buses or whatever. From a general public health perspective, it makes no difference. So recognize there's a difference of opinion in the fiqh. One group isn't smart and the other group stupid. It's an understandable difference which reflects a lack of leadership both amongst Muslims and amongst the government, actually.
As we bring the podcast to a close, I'm glad you made that point, because the way it has been presented, like this kind of difference between those masajid and institutions and movements that said no, masajid should remain open until the very last minute, or in the Muslim world in places like Pakistan, Bangladesh, where they're still choosing to keep masajid open. It's been presented as if those who are calling for closure of Jummah and congregation prayers very early on were more kind of the progressive, nuanced school of thinking of scholars and tulab al-ilm and activists. Whereas those who are calling for, hey, listen up guys, let's just take some precautionary measures. Let's look at each city or town case by case. Let's take the feelings of the musallis and the congregation in mind, that they were kind of presented as the kind of more regressive, backward guys. It was kind of presented as that, at least in the online sphere, right? Where we even had a number of prominent du'at from the US, right, who are using this kind of language that those who are calling for early closure are more progressive and more nuanced and robust in their thinking, and those who were persisting in keeping the masajid open still had a very backward, Desi mentality that, oh, Allah's house is the protective house of everything, and there was an absence of medical thing. I find it very uncomfortable.
It is
That
uncomfortable.
really,
It isn't nice. And in fact, the irony of it is that actually, when you look at it from a public health perspective, if the measures that have been taken were the kind of measures that, like from an Islamic perspective, this idea of, first of all, the place where it starts should be locked down. Literally, nobody should be in, nobody should be out. All right? That's number one. Number two, if you'd followed the best public health model of contact trace, testing, isolating the people with it, contact tracing their contacts and isolating anyone who's tested positive. Actually, in those countries, the society carried on largely, those people who are not affected by it largely carried on with their daily lives. So in that model, you wouldn't have to necessarily suspend a wajib completely. You might rather put measures in the mosque that was strictly, if you have symptoms, you're banned. Yeah. If you have use the hand washing, contact mats on the floor, sanitizer, all these things. In fact, you could have gone even further. You could have volunteered the masajid to be the center for testing. And then that would be starting the isolating, quarantining process. Yeah. And in that thinking, so it's a lack of nuanced thinking on both sides, but at the same time, we are going to have a difference on this, and don't start attacking your brothers over this kind of thing. It's wrong. It's not the right way. It's not that kind of a matter that's so clear cut.
yeah. Final question of today's podcast.
Yes,
I know you're gonna have a pop at me saying that you've not exactly left me much time to answer.
No, that's fine. That's fine. No problem.
There's also a discussion taking place within Muslim communities, especially the Muslim world, but also here in the West, that is the coronavirus pandemic a punishment from Allah subhanahu wa ta'ala, or is it in fact a test and a reflection of Allah's mercy to the ummah? And I guess those who have argued that this could be a punishment from Allah have cited verses from the Quran that the corruption of the hand and the land and the sea is to do with your own doings. That's a paraphrasing of the verse. Others are saying, no, we cannot conclusively say this is a punishment because we don't know Allah's will. But there is that discussion taking place. What's your thoughts on this?
We know Allah subhanahu wa ta'ala says, بعد أعوذ بالله من الشيطان الرجيم ولنبلونكم بشيء من الخوف والجوع والنقص من الأموال والأنفس والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المفلحون muhtadun. وَأُولَٰئِكَ هُمُ الْمُهْتَدُونَ. Allah says, verily we will test you with something of fear, all right? And people are afraid, right? وَنَقْسٍ بِالْأَمْوَالِ وَالْأَنفُسِ, and some loss of your wealth and your life. So there'll be fear of loss of wealth and life, and there'll be real loss of wealth and life, right? So Allah's testing us. وَبَشِّرِ الصَّابِرِينَ, and give glad tidings to the sabirin. And this is how I look at it, because Allah says, those, the sabirin, those who when an affliction afflicts them, they say, Inna lillahi wa inna ilayhi raji'un. Like, we are from Allah and we'll return to Allah. And those are the ones that Allah subhanahu wa ta'ala says, His salawat, His blessings will be on them, and they are the ones who are rightly guided. So actually, in the end, this becomes a test for us in how we behave in our shopping, in our hoarding or not hoarding, how we behave with our neighbors and caring for them, because you need to look out for them as well. We have a guy next door to us who is on his own in his 80s, and my wife sends me, my kids round to check before we go shopping. Do you need anything? It's a test for us as a community in how we deal with each other on these issues like difference of opinion. And in the Muslim world in particular, it's a test for us in terms of how we behave in terms of on a societal level. Is the society being governed by people who are looking after the affairs of people according to Islam or not? And if not, why aren't we speaking up about that? Why aren't we trying to change the system about that? And such are the tests that fall upon us. And the test that, do I believe that Allah is the one who controls disease and sickness and health,
Yes.
and brings the cure?
Yes.
Or do I have faith
Yes.
in my own self-isolation and social distancing and my doctor and the hospitals? Yeah. Do I believe that my life and death is in Allah's hands and it's written? All right. Or am I so scared of death that I'm in a panic mode at the moment? And so I do believe that. And in fact, Rasulullah sallallahu alaihi wasallam, he said in one hadith, إِنَّهُ عَذَابٌ يَبْعَثُ اللَّهُ عَلَى مَنْ يَشَاءُ. Indeed, Allah will punish people with a plague, whomever He wills. وَأَنَّ اللَّهَ جَعَلَهُ رَحْمَةً لِلْمُؤْمِنِينَ. And Allah will make the plague or these kind of things a mercy for the believers. How can such a thing be a mercy for us? Yeah. Well, mercy comes when Allah makes a hardship you have as a purification for your sins. Mercy comes that if Allah takes the life of a believer through this plague, inshallah, He takes them as shaheed. Yeah. And the akhirah. Inshallah. Mercy comes because we start behaving better, inshallah, with each other. Mercy comes because we start to look to His deen to solve our problems and to understand and draw closer to Allah. So I think we need to just be a little bit more conscious of these things. And I don't say these two evidences where we cause corruption at our own hands, and these evidences are mutually exclusive. Actually, they're not mutually exclusive. Yeah. Humanity has caused corruption at its own hands on the earth, right? But some of the victims of this plague are not people who had any control over that. And therefore, we know that through this, Allah subhanahu wa ta'ala brings His mercy, and it's not just about punishment. And so maybe if there's one blessing, if that can be called, or one good thing that can be called, is that people maybe are more conscious of Allah subhanahu wa ta'ala and more thoughtful about the way we live our lives as people, because I don't think this message of Islam, this mercy of Islam, this Prophet of Islam sallallahu alayhi wasallam was a rahmah for the Muslims. He was a rahmah for al-alameen. And maybe other people around the world will see this as well through this, that actually there is something there about the way we've been living that is diseased, yeah, and in every way, that there's a real problem with the way we live as humanity.
Jazakumullah khair, Abdul Wahid.
Barakallah Dilly. And may Allah keep you and your families, your family and your loved ones, and all the brothers and sisters watching safe in His protection and His care. And may He keep this ummah safe, and make us not forget that there's much suffering out there aside from the coronavirus in many places around the world. And we don't forget about those Muslims, and keep actually everyone safe and bring every person goodness through this, because this is something affecting everybody actually, and there isn't a single person who's not affected by this in some way, shape or form.
Allahumma ameen ya Rab. Jazakumullahu khair.
Barakallahu.
Brothers and sisters, that's all for today. Please like and share this video. Subscribe to the 5 Pillars YouTube channel. Please use a lot of the things which Dr. Abdul Wahid told us about, reflecting upon, Allah's existence, death, how we as Muslims are living in the societies in predominantly non-Muslim lands in the West. Think about our brothers and sisters who, putting aside the pandemic, the plague, the suffering that's been taking place, put into perspective that perhaps we are tasting a very minuscule level of difficulties that Muslims around the world are facing on a daily basis. Use this time for reflection, use this time to get closer to Allah subhanahu wa ta'ala, and reflect upon the indisputed reality of death, and use this time to get closer to Allah. And inshallah, I pray that Allah protects our loved ones, protects the Muslimin, protects those who are oppressed, protects those who have been affected by this, safe, inshallah. Ameen ya Rab. And until next time, assalamu alaikum wa rahmatullahi wa barakatuh. And before I close, there will also be updated stats on the screen right now. Take care, brothers and sisters. Assalamu alaikum.
Blood Brothers podcast, a 5 Pillars of Mad Monolith production.